support messaging and support in general to the more disadvantaged areas. It was obvious to join hands. We are very much focused in everything we do on the most vulnerable children in our case, and I think in the United Nations on the most vulnerable populations, wherever they may be and whoever they may be. UNICEF has for some time now tried to step up and support particularly the health services, strengthening the health system to respond to COVID-19 since the pandemic began, with supplies, both personal supplies for individuals, but also in health centers where they are most needed, where there was a lack of capacity that needed to be reinforced. And so we're happy to continue that work, and also to get messages out there about personal preventive measures, like Dr. Singh was talking about, how important it is that we all, every single individual, every single service, collaborate and take the appropriate measures wherever they may be. We are present in the north, we're present in the east through offices, so that we can be as close as possible to the vulnerable population, and we will continue this work. Just to mention a few things around education. We all know that children have been, for the most part, the past 18 months away from school, at home, trying to continue their education. It's not ideal. It has been perhaps necessary at times, but we are very eager to get children back into school. It doesn't mean they will all go back at the same time and to be there all the time, but it is the strong recommendation across the world to have as many children as possible back into school. And talking about backward areas or most vulnerable populations, the children that are the poorest, that are more marginalized, have lost the most during this pandemic in terms of education. So they are the ones who need to go back most urgently. They don't have access to internet, and they have not been able to follow an interactive educational program during these months. Many of them don't have TV or radio even. So the earlier they can get back, the better for them to catch up. And we need to strengthen the remedial classes as well so that they can catch up, because the worst thing we want is for the gaps that already existed before the pandemic in terms of learning outcomes to be more profound. We know also from experience in Sri Lanka that children can get back to school under safe conditions, and as Dr. Singh mentioned, schools are not anymore dangerous, or there's not more transition in schools than in any other place in the community, as long as the appropriate measures are taken. This has happened in Sri Lanka before, and it can happen again. So very much looking forward to having the children go back to school progressively, but rather quickly. Thank you very much for being here, and thanks for inviting us.